Hi, Mary. Hi, Timmy. How are you guys?
Good, how are you?
I'm doing well. Thanks for asking. So, what brings you guys in today?
About 3 months ago, I brought Timmy in because he was kind of limping a little bit, and I just started to notice it, and I was just kind of worried. He said he didn't really know like what happened or why he was limping, and just that it hurt a little bit, and so I brought him in, and we did an X-ray, and you guys didn't say anything's wrong, but he's still limping, so I'm just kind of getting more concerned.
Yeah, I remember when you guys came in a couple months ago. Yeah, and I remember taking that X-ray. And he's still limping then.
Hmm. Yeah,
Okay.
he is.
And does anything appear to be making that better or worse?
I don't think so.
No. And is it painful when he limps?
He says it hurts a little bit.
Okay. Okay. Um. Okay. Any other symptoms that you're concerned about?
No, not really.
Okay. Well, we're going to go ahead and start with some vitals and just a basic head to toe. And then probably what we'll do is take another x ray and see if anything's changed of that leg and that hip, just to make sure um, nothing has changed and we're not looking for anything. So we'll start with some quick vitals. Um, so everything looks normal there. Temperature, blood pressure, everything looks good. Um, And I am noticing on your head to toe, Timmy, that your one leg is appearing a little bit shorter than the other one. Mary, have you noticed that at all?
No, I haven't.
Okay, yeah, it's not like a lot. I mean, it's probably not something that you would just like notice, but if you're looking for it, it is a little bit. And when I'm trying to move his leg and do what we call range of motion, it does seem stiff.
Mm-hmm.
Um, yeah, and like I said, that leg is just a little bit shorter. I'm not noticing any difference in the muscles right now.
Okay.
Um,
Is
so
that is
yeah.
that a good is that a good sign or?
Well, I think the X-ray will tell us a lot more information about what's going on. It does concern me a little bit that his leg is shorter because given his age, I mean he's only 5, so that probably shouldn't be happening.
Mm-hmm.
He should be growing pretty symmetrically. Um,
Mm-hmm.
So, and just based off the range of motion, it seems to be more of a problem in his hip than anything else. So, we'll go ahead and take him back for that x-ray, and then we'll just sort of go from there and see what that can tell us.
Okay, sounds good.
Okay, so fast forward, Timmy had an x-ray, and now we're back in the exam room. Okay, Mary. So we got Timmy's x-rays back, and what we're noticing is that so his femur, which is the leg in his thigh, at the head of his femur where it meets into the hip socket,
Mm-hmm.
it seems like there might be some breakdown of the head of that femur.
Okay.
And so just based off of that and then all his other symptoms, the hip stiffness, the limp, the leg being a little bit shorter, it kind of seems like he has something that we call leg calf Perthes disease, um, which is just a big name for the people that discovered it. And so basically, what this um, is that for some reason, and it's not completely understood why, the vessels that bring blood into the head of that femur, for some reason that's not happening the way it's supposed to. And so what happens is over time, as there's less blood supply to that part of the bone gets fragile and it gets weak, and it can
Mm-hmm.
start like chipping away and actually like deteriorating. And so that is what his x-rays have showed just on that one side, because sometimes this can happen in both, but it's not very common. But for him, it's just as one. um so basically, what we do, and like the onset is usually between kids 4 to 8, so he falls right into that, and it's a lot more likely in boys, and he fits into that as well, of course. Um, so yeah, and like you said, you came in 3 months ago when he had this limp, and so the reason that we probably didn't see anything on the X-ray then is because it takes time for that bone to kind of break down, and the body naturally, what your bones do is they break down and then they rebuild themselves. So it's still trying to do that. It just
Mm-hmm.
doesn't have the blood supply to get it done
Mm-hmm.
properly.
Okay.
So that's probably why, you know, you did a good job bringing him in and then coming back. Like that was definitely the right move because that's probably what we would have recommended anyways. And
Mhm.
so, I mean, there's nothing that you could have done to bring him in earlier or anything like that. Like it just takes time to see it on the x-ray. So yeah, does that all make sense? Do you have any questions about kind of what it is and how it works?
No, it kind of makes sense. What are some things that I can do to like what is kind of the steps from here, I guess,
Yeah,
on
okay.
how to like
So
fix this issue?
yeah, so here's kind of the treatment pathways. One of them is surgery, which I don't think at this time is probably necessary. Usually we try to do kind of some more conservative treatments before we jump into that, but we'll
Mhm.
definitely keep tracking him from here.
Mhm.
So so probably what we're gonna have you do is I don't know if you've been giving him any pain medication up until this point.
I've just been giving him like children's Tylenol
Okay.
occasionally, but only when he complains about it.
Okay, yeah. So probably what we'll have you do is give him NSAIDs, just yeah, like those mild,
Mhm.
ibuprofen, all those just for mild because he doesn't sound like he's in that much pain from what he told me. It doesn't sound like it's, that
Mhm.
painful, but definitely keep monitoring that and then call us if the pain suddenly gets worse or it's like lasting a lot longer than it was.
Okay.
And then what we're gonna do too, and this is probably gonna be a little bit difficult for him just because 5-year-olds, love to run around, as I'm sure you
Mhm.
know, is try to have him stay off of that leg as much as he can, lots of rest and then limited
Mhm.
weight bearing on that leg. So
Mhm.
don't, like running, try to
Mhm.
avoid that. Even like a lot
Okay.
of walking in the day, like we're gonna try to
Okay.
avoid that too. Um, and so I would just like to have you at first try to just get him to stay off of it as much as he can without having any sort of like device to help him do that. But if that becomes a problem and it's getting worse, or you just notice that it's too hard for him
Mhm.
to just remember to stay off of it, we can do these. We can do casts, we can do physical therapy might help, and then like traction, which is like we'll just have his leg stay kind of in one position so he can't really put weight on it.
Okay.
um and then also what we have to make sure is so this if it doesn't need surgery, this can generally heal itself. And so but the thing that we have to make sure is that when that head of the femur starts to come back, we need to make
Mhm.
sure that it's still round so it fits in
Mhm.
that hip socket.
Okay.
And so we're going to keep taking x-rays, and then if we notice that it's not really forming back in that nice ball shape like we want it to, what we're going to have him probably get put in is an abduction brace. And so basically it's kind of looks like a girdle, and it
Mhm.
keeps his one leg out, and so that way
Mhm.
it pushes that bone into the hip socket, and so
Mhm.
the socket can kind of be a mold for the
Okay.
bone building back.
Yeah.
But we'll probably just that those are kind of just like the near future, like far future steps more like.
Mhm.
So we're just gonna keep watching it, keep taking x-rays, tracking it, um and then yeah, we'll just kind of go from there. But for now, NSAIDs, limited weight bearing, and lots of rest is probably going to
Okay.
be the best thing for him.
Okay. And then if it doesn't resolve in a couple months, should I bring him back in?
Yeah, I would say why don't you bring it, like we're probably just going to do monthly x-rays
Mhm.
from here on just to make sure that that's forming right. That way, if we have any concerns, we can get ahead of it a lot quicker and get him in either the brace or maybe start thinking about surgical options. But as far as right now, I would say let's just start kind of conservative and then see where we can go from there.
Okay. All
But if
right.
if his pain, like I said, if his pain gets worse or he is complaining more or like, and now that you know that that leg is a little bit shorter, just watch it and just kind of measure it and see if like you really notice that it's like getting a lot shorter, or if the muscles in that leg start to get smaller. We call that muscle wasting. Call me or call the office, and then we'll get him in and get him another evaluation and see if we need to make any adjustments to the treatment.
Okay. All right. Thank you so much.
Yeah, you bet. Do you have any more questions for me?
Nope. I think that's it.
Okay. Well, you just let me know if anything changes or you have questions or anything like that. You can call me or you can call the office and leave a message, and somebody will tell me and I can get back to you.
Okay, awesome. Thank you.
You bet. Have a good day.
You too. Bye-bye.
Bye.